Thank you very much, Madam Secretary. And again, it's a pleasure to have you here. The President's budget is being touted as adhering to spending caps agreed on last year, but it does so by the inclusion of gimmicks which shift funding onto the mandatory side of the budget ledger. For example, as you know, and it's been mentioned here, actually by both sides, NIH discretionary level is reduced by $1 billion from FY 2016 levels. Let me just tell you up front, that's not going to happen. We're not going to be cutting $1 billion out of the NIH. And frankly, we're unlikely to be able to get mandatory funding of $1.8 billion. Again, we have no jurisdiction in that area, but we'll make a prediction that we're unlikely to be able to get that. Having said that, that means, and that would probably apply to the other mandatory areas that you called on as well, although we'll look at each one of them individually, obviously. Given that, we're going to have to shuffle money around to maintain programs because we don't have our allocation yet, but the entire discretionary side of the budget, I think, was increased by 0.1% under last year's agreement. So there's not a lot extra there. So we're going to have to make some really tough decisions. It'd be very helpful to us if you would tell us what are your top 3 or 4 priorities within the budget and that you think are absolutely critical to being funded.
So as we think about the issue of tough decisions, I think you appropriately reflected when we look at the second year of the deal, it's a very, very small increase. And with other things that happen naturally, that the question of is it an increase at all for most of the bills, I think is an important one. And I think that's a reflection of the fact that where our discretionary levels are. In this budget, by 2019, we will have one of the lowest levels of our discretionary to GDP ratios that we've seen as a nation. And so I think the question about priorities and tough decisions, I think we feel we made those because everything is paid for. And that's the issue when we talk about the budgeting in terms of the mechanisms that we use, discretionary or mandatory. I think what we're all focused on is how much we spend and how that affects and impacts the deficit. And the budget overall keeps us on a downward trajectory. We made decisions that may not be the ones that folks agree with, and we understand and appreciate that, but we do pay for everything, and we do continue on our path of deficit reduction and making sure our debt to GDP ratio is on a declining path as well as our deficit. So in making the tough choices and the prioritizing, we've done that in the means by which we pay for these things.
I'm the last person to cross swords with a former OMB director about the budget, but I don't think we're on a downward trajectory. Certainly in gross dollar terms, the deficit's going to be higher this year than it was last year. And I think this is off our topic, but I think one of the great missed opportunities of the President's second term was real entitlement reform. There was a couple of times he was close. I mean, he put, to be fair to him, change CPI on the table, and he put means testing for Medicare on the table. But he also demanded tax increase, a lot of other things with those. We could have probably passed those things, and I think they would have been a material improvement on where we are now. But that aside, we're unlikely to be able to do that in the short term in the amount of time that we have left. And what we do have to do and want to achieve is to actually give you a real budget. So I want to return again of the budget itself that you think are absolutely critical to the functioning of health and human services.
So as I said, I think we've put together the budget in a way that reflects the priorities. I think we've heard criticisms, and I'm sure I'm going to hear them today in terms of the cuts that we've made to other areas, places where we have not in its totality fully funded and had to make choices. And I'm sure we're going to talk about those, whether that is the issues of REACH or the issues of BARDA. I'm sure that we'll talk about those today and have made a number of those choices. The other thing I would just reflect as we think about the overall budget picture is the question of demographics in our country. And we know that healthcare is one of the most fundamental drivers of the costs that are causing these issues. But I think we also know that the basic demographics in our country with regard to we're going to have more people who are in that Medicare band. And so how we think about a balanced approach, and that's gets to this question of revenues versus cuts, because the problem isn't simply a problem of a set number. It's that increase. And, I keep my eye on per capita healthcare cost, and in Medicare, we've seen those be, very low for 6 consecutive years. And so as we continue to think about it, I think that's an important part of the conversation, which I think I welcomed in my OMB job, and I welcome here.
You did, and you've always been a good person to have that dialogue with. With that, I want to move to my ranking member for whatever question she cares to put to you. Thank you.